I'd like to invite Trevor to switch his screen on and join us, because he's going to be sharing some really great tips and information about how you can manage hand pain. So Trevor, first of all, thank you very much for joining us. Also, just to let people know, we've got a poll running right now about how to reduce hand pain, and it looks like most people have been confused at some point about how they can reduce their hand pain. So it's a good job that you're here. A reminder to everyone in our audience, we have a Q&A box at the bottom of the screen. So if you have questions for Trevor, you can pop all of those in there and I will ask him. He'll have 10 minutes, maybe 15 minutes for questions at the end of the session. If you'd also like to learn a little bit more about Trevor, we've put all his bio information and links in the chat box. I should mention that Trevor and I work very closely together. We are co-founders of our company Grace Enable, but for this session, Trevor's got his hand therapist hat on. So without any more preamble, I'm going to hand it over to you, Trevor.
Great, thanks, Sarah. Yeah, you're right. I wear many hats. That's true. Hello, everyone. I'm Trevor. I'm here to talk about how to help with your hand pain, particularly as it relates to arthritis, which is the reason most of you guys are here. First, I'm going to talk about what are some of the causes of hand pain. There are lots of things that go along just with arthritis. There are many forms of arthritis. There are a lot of what we call comorbidities that go along with arthritis, and I want to touch on some of those. And then I'm going to talk about what is pain anyway. It can be a pretty confusing subject. A lot of people just take it for granted, but if you're going to do things to help with your hand pain, having an understanding of what are the mechanisms of pain, what causes pain, are probably helpful to help you finding the right interventions to help with your pain. And then I'm going to give you specific things, activities, exercises, things you can do to help reduce those symptoms of pain. So the main reason we're here, arthritis, obviously, it's one of the most prevalent causes of pain, especially in the United States. According to one study, up to 47% of women over the age of 45 are going to have some symptoms of arthritis at some point during their lives. The two most common forms of arthritis are osteoarthritis and rheumatoid arthritis. The difference being that osteoarthritis is a mechanical breakdown of the joints. It usually occurs in the hand at this joint here. You have it usually at this first finger joint right here. And then it usually shows up in the tips of the fingers. Sometimes you'll start getting little bumps or nodules at the tips of the fingers. And that's sometimes an early sign of osteoarthritis. And the other second most common form of arthritis is rheumatoid arthritis, which is a generalized inflammatory condition. Basically, your own system is attacking your joints, your cartilage. For some reason, there's a trigger that makes them think that there's something in your joint that is an enemy, and it creates this inflammatory process. In the hand, that's going to be fairly diffuse. It gets into those little carpal bones in the wrist. And that will more often affect the more proximal joints here. That's sort of the main clinical difference between osteo and rheumatoid arthritis that I look for. If it's usually out in the tips, that kind of tells me that that's probably osteoarthritis. And then if it's more in these finger joints here, usually that points me towards more of an RA or some sort of other rheumatological condition. There are also over 100 other causes, other forms of arthritis as well. Some things that will oftentimes go along with arthritis, they're very common comorbidities. Tendinitis is a big one, particularly with rheumatoid, but also with osteoarthritis. Your body, when it has an inflammatory response, either to rheumatoid, osteo, or something else, it's not like it has these laser guided smart bombs that goes right to the source that it needs to try to fix. It's a bigger response. It's more of an area effect. And so if you have a little bit of a irritation at a tendon or some other soft tissue structure in that area, it's not uncommon to develop forms of tendinitis with these things. And the most common ones for hand arthritis are deeper veins, which is pain running down here. There's a tendon that goes right by the base of your thumb that can be affected here. You can have tendonitis of what's called the FCR, or flexor carpi radialis, which it goes right here. And again, you can see that kind of starts going right by that base of the thumb there, where people get a lot of arthritis. And then trigger fingers, which is oftentimes early signs of trigger finger is aching, sometimes at one finger, sometimes multiple fingers, but it tends to be right at the base of the finger right in here. And then you might start noticing a little bit of a creak in your fingers as you move them. And then as it progresses, it becomes this pop where you can't quite extend your fingers and they kind of pop open like that. That's why it's known as trigger finger. And then you have nervy issues that will come along with this as well. So the most common one people know of, and many of you probably have experience with, is carpal tunnel syndrome. And that's affecting the median nerve as it runs right through here, through the palm. Signs of median nerve impingement or carpal tunnel syndrome are numbness and tingling out at these 3 digits, the index finger, middle finger, and the thumb, and sometimes a little bit of that ring finger, but it's usually from the tips up. And then pain right here at the base of the palm can be an early warning sign of some carpal tunnel coming along. Cubital tunnel, which is going to be over in these 2 fingers, and that's actually not an impingement in the hand itself. It actually occurs up in the elbow up here. But what will oftentimes happen with cubital tunnel, and also the next thing I'm going to talk about, radial tunnel, is whenever you have pain in your hand, we all tend to be a little protective, right? It's human condition. We don't like pain, obviously. And so especially when we're sleeping, we might curl up, or we might keep that hand close to our body to prevent it from being bumped, or from to remember not to use it. And that stress across that elbow can start impinging that nerve down there and create numbness and tingling along this side of your hand. And then radial tunnel, as I was talking about, is an impingement in the back of the forearm right here. And it will sometimes create numbness and tingling back through here. And then sometimes up into the back of the thumb, and up into these 2 fingers. Now you'll notice that the same 3 digits that are involved in carpal tunnel, very common for me to have people sent my way with diagnoses of carpal tunnel when actually it's radial tunnel, just because it's on the backside there. And again, same thing, it's because we're in pain. We're trying to work around that painful joint. And so we start creating some overstress to these muscles, they get tight. And then that creates that impingement of that nerve as it's trying to come up into your hand. And then a group I just lumped into other. That includes Raynaud's, which is a circulatory issue. So your fingers get white, or even sometimes even blue, especially when it's cold out, because you're not quite getting the circulation, because those capillaries aren't dilating and constricting the way they're supposed to. Ehlers-Danlos Syndrome, which is a connective tissue issue, where the connective tissues have a little too much elasticity to them. And so especially at these joints here, those ligaments that usually hold them in place have a little bit more wiggle than they should have, and that creates some painful rubbing at those joints. And that can actually lead to osteoarthritis type presentations. And then lupus, scleroderma, gout, those are sometimes lumped in with arthritis. Again, those are sort of rheumatological inflammatory conditions. And then the last thing I sometimes see, it can be a cause or it can be an effect. Sometimes it's not really well understood, is ganglion cysts, which are benign lumps. They usually occur here in the back of the wrist or here, and sometimes in the digits as well. And they just take up space, and there's not a lot of space to spare in your hand. And so that can create irritation to those joints or other structures around there. So those are things you can sometimes see along with arthritis that create hand pain. So what is pain? It seems, like I said, a very obvious question. Ouch, it hurts, that's pain. The problem with that is that it's impossible to take an objective measurement of pain. We've made lots of attempts to try to figure that out. How do we objectify or quantify how much pain someone's in, so that I, as a clinician, or your doctor, can see, okay, well, you were with this many units of pain, and now you're at this many units of pain, and see how much improvement you're making. And it doesn't really work that way. We've tried a visual analog scale, which is basically smiley faces that we line up and you point at, and whatever that, sometimes it's a frowny face if you're in a lot of pain with tears coming down. And you say, that's how much pain I'm in. I recognize that. Or it's a scale of 0 to 10. And I'll say, on a scale of 0 to 10, how much pain are you in? 0 is no pain. 10, I'm going to call an ambulance because that's the worst pain you can ever possibly be in. And again, that can be fairly inconclusive, and it's sort of helpful for when someone comes in at one point and then a couple weeks later, I can ask them that question. If there's any change, I can hang my hat on that and say, look, you've made some improvement here. You were a 6 and now you're a 4. It still hurts. It doesn't feel great, but you're telling me it feels a little bit better. And the problem is that there's not a pain pathway, right? There's not like a nervous pathway that is, strictly speaking, a pain response. We have what's called a nociceptive pathway, which is a discomfort or a noxious stimulus, but it's not always pain. The example I always use is when you're sitting in a chair and you sort of shift your weight, you're not necessarily hurting, but the nociceptive pathway is telling your brain, hey, there's been a little bit of pressure on the same spot for a while, let's move. And so that's the same pathway as some pain responses come from. And then once it gets into the spinal cord and the hindbrain and the upper brain, there's all kinds of things that affect that pathway and affect our perception of what that signal is trying to tell us. There were some studies that tried to find the pain center of the brain. One claimed that the central amygdala was responsible for pain. Then there was another big study, and these were both in the last 5 to 10 years, that showed the dorsal posterior insula of the brain modulated pain responses. And then there was a lot of back and forth. People released these counter studies and these counter arguments to refute these studies. But really what came out of that is that there's areas that maybe light up more, and there's a correlation to those areas of the brain and our experience of pain. But there's also 20 other centers of your brain that light up at the same time whenever you have a pain response. So it's multifactorial. There's a lot of things that go into pain. So what does that mean? So there's a couple of pain scientists, so to speak. It's sort of been this blossoming, burgeoning center of study over the last couple of years. One is a physiotherapist / chiropractor out of Canada, and he does a lot of work on chronic pain. He has a website with a blog. It's called The Biomechanics of Pain Science. He even has this very nice worksheet you can do to kind of help. What is your pain? What can you do to correct it? And he uses what's called a cup analogy. So basically, we all have a cup, and it's filled not just with the input from our nociceptors or whatever that painful stimulus is, but you also have things that are like external stressors. So if you stub your toe and otherwise you're having a great day and you got a raise at work and you are feeling great, it's a sunny day, maybe that stubbed toe doesn't quite hurt as much because there's room in that cup for a little bit of extra negativity, a little bit of extra negative stimulus. But if that cup is up to the brim to begin with, you've got a lot of stress in your life. Maybe your kid's sick, or you're struggling to make ends meet, or you just got some bad news. There's not going to be enough room in that cup. And all of a sudden that stubbed toe feels like that's an 8 or a 9 out of 10. So that's a very interesting way to approach this as well. And it gives people some authority to raise or lower other things in their cup that might help with that pain response. And then there are the authors Butler and Mosley that have a book called Explain Pain, which also extrapolates on some of this. And Butler, Mosley, and Lehman have kind of gone back and forth over the years, but they have a very similar approach to a multifactorial cause of pain. So why am I going over all of this? Why am I talking about what is pain? Again, at the outset, I want you to understand what is pain so that you can better understand how to control your hand pain. So there's a couple different ways to do that. The most obvious one is activity modification. Simply put, if it hurts, stop doing it, right? It seems pretty straightforward. The problem is, if you don't have any pain in your hand, but that's because you're doing nothing with your hand, what's the point? There's no point. You want to use your hands to do the things you love. And my job is to help people find ways to do the things they want to do. And so you can also modify whatever that activity is by either changing the way you do it or changing the things you use to do that activity. We just came out of a demonstration for a modified car seat, which I thought was wonderful. And that showed a way to modify an activity so it doesn't hurt your hands as much. Another thing you can do is energy conservation. So it's a way of modifying an activity. So I had a woman that came in a few years back. She had a bunch of rose bushes. She had arthritis in her hands. She came in, she was all flared up. It was spring, and she had to do a bunch of pruning for her roses. And she had like 50 rose bushes. And she got halfway through and her hands were killing her. And she just thought to herself, well, I can't stop. I can't leave it halfway done. And so she kept powering through it until her hands were just basically useless for the rest of the day. And so we talked about, okay, in the future, next time, how do we approach that? So we say, all right, I'm going to do 10 rose bushes, check in with my hands. I'm going to have another activity waiting on the side so that I don't feel like I'm just sitting and waiting for my hand to recover, but I also feel like I'm giving my hands a break. And then after a few minutes or half an hour or an hour, or however long it takes, you do 10 more. And you give yourself permission before you even start to modify that activity in a way that you walk away from it, but you're not leaving it undone. You're just taking a pause, you're taking a break. Another thing you can do to control your pain, self-care. So as Greg Lehman's analogy of the cup says, if you can lower some of those things in that cup, that sometimes helps with your overall pain. So trying to look around at your life and think about, okay, well, what are some of the other stressors out there that maybe I can reduce? How do I have agency over my own pain or my own stress? There's real evidence that shows that there is a very physiological response that your nervous system has to increase stress. Cortisol, adrenaline, that affects nerve health, and unhealthy nerves are going to send stronger signals to your brain that your brain will then interpret as increased pain. So if you can control those other stressors as best you can, sometimes that will help you get those, especially those chronic arthritis related pain symptoms down. And then hot and cold are a great way to help with pain. It's a way to get a flare up of pain under control or to get tight muscles to relax. So heat theoretically is going to increase blood flow to an area, which is going to help promote healing. It's going to feel usually really nice for my patients with osteoarthritis in their hands, especially. They really like heat. It's also going to have effect on your sympathetic nervous system, which is what goes into overdrive when you're under a lot of stress. So if you can take yourself out of that sympathetic nervous response and get yourself into more of a parasympathetic state, heat's a great way to do that. Following that, those exercise tips that we just saw at the break right before me, that's a great way of reducing stress and taking care of yourself as well and getting that sympathetic nervous state under control. Cold is going to have obviously the opposite effect of heat. So it's going to constrict those blood vessels. It's going to decrease the amount of inflammation that can get to an area, which should hopefully help regulate that pain response. It's also a topical analgesic, so it just makes everything that hurts numb, which can feel nice. I will say that 95% of my osteoarthritis patients aren't a big fan of cold. And especially if you have some of those other concurrent issues that I mentioned earlier, sometimes they may not respond as well to either cold or heat. And you should probably I always defer to the patient at the end of the day. They say, well, which one should I use? And I say, well, which one feels better? If you feel better, you're going to move better. And if you move better, you're going to improve the way you feel, the way you heal, and the way your brain is processing any sort of chronic pain. And so you should always make sure that you're taking care of yourself. As I mentioned, exercise, very important. I always tell my patients that stress through those joints, it helps improve your load tolerance through those joints. It helps joint health. Your joints want to move. That's what they like. And if they can't move at all, that makes them a little grumpy. The trick is finding that just right balance between enough motion to help with joint health and too much motion that makes it irritated. And so moving as much as you can move, or moving the joints that are distal or proximal to whatever that painful joint is, can help as well. And then the last thing you can do to help control pain, supports, external supports, wrist braces and compressive devices, sleeves and gloves are great methods of controlling pain. And I'll go into those specifics here after we talk about exercises. So some specific exercises that I give to a ton of people almost every day, especially if they're coming in with any kind of chronic pain state or arthritic flare-up. I give them six-pack tendon glides, isometrics, which we'll go over all these specifically. Sometimes we'll talk about gripping, either a tennis ball or some putty. And then the last thing I really like, especially if you spend a lot of time in front of a computer or any sort of static postural state, is what's called a Sirage decompression stretch, or Sirage nerve decompression stretch. So specifically, they look like this. So your six-pack tendon glides, and you can do these along with me if you like, but I always want you to keep in mind that these are supposed to reduce pain. So a little bit of stress, a little bit of stretch, that's all great. You should feel a little bit of something. But if this increases your pain, stop what you're doing, right? The whole point of this is, how do you reduce pain? So only do them as much as you can that feels good. Listen to what your hand is telling you. I always tell my patients, listen to your hand, listen to your pain way more than you listen to me or the magic sheet of paper with your exercises I send home with them. Don't get caught up in the number of repetitions at times per day, as much as move as much as you can that your pain and allows you to. Listen to your body before anything else. So tendon glides, six-pack tendon glides. You're going to go here first with the straight fingers. You're going to come down to a hook, come down to a flat fist so you can see your fingernails. And then you're going to tuck those nails in for a regular fist. And then you're going to come up here, making a tabletop. And then you're going to come back up straight. Sometimes, especially if you've been at hand therapy before, you might go, hey, that's not quite right. Sometimes they'll come down and come back up and come down to a flat fist and come back up and a fist and back up, tabletop, back up. That's fine. There's no research that suggests one way is necessarily better than the other. Sometimes they'll flip the order of things too, depending on what worksheet you're working from or where you learned it from. The next thing I do is isometrics. So isometric exercises, isometric means that you have a co-contraction of all the muscles around an area, but there's no motion of the joints. You're not putting extra stress or strain by moving any of those painful joints. These exercises, by the way, I stole directly from a book called, oh my goodness, it's by Jan Albrecht, and it's called Living with Painful Thumb. And so if you want to check that out, it's obviously available oftentimes on Amazon. Caring for the Painful Thumb, Caring for the Painful Thumb by Jan Albrecht. And she's got a ton of great other exercises, and there are pages and pages of it that I just don't have the time for. But these are the ones that I have taken and I give a lot in my practice. These are the ones I've sort of parsed out as the really good ones that I like. So you're going to do what's called an isometric C, which is like this. You're going to have a nice arch here. And then you also want to think about having a nice arch here. So you don't want to have a thumb that looks like this. Unless, of course, you try to do that and it hurts. Do whatever feels the best. So if that's as far as you can get, that's as far as you can get. So you have an isometric C, and then you gently contract the muscles in your hands. It's like you're squeezing an invisible ball, very, very gently. No pain. Okay, a little bit of stress or whatever the painful spot is fine, as long as that pain level is not creeping up. And then relax. And then gentle squeeze and relax. Nice and easy. Okay, you don't want to overdo it. Make sure that you're only gently stressing these joints. The next one is a circle. Again, try to get that circle as big as you can. Some of you may have an oval, and if that's as big as you can make that circle, that's fine. But try to get that nice arch again. Again, your thumb likes arches. It makes it very stable. It decreases the amount of shearing at whatever joint it is that's affected. In this case, the base of the thumb is what these exercises are mostly for. And same thing, you're just going to gently contract all the muscles in your hand, and then relax and contract and relax. Nice and easy, no pain. Yeah, I'm sounding like a broken record here, but again, this whole point of this talk, reducing pain. So if you're doing these and your pain's going up, back it off. Sometimes I'll have people leave a little bit of a gap so they're not pinching too much as they're doing these. It should be a very, very gentle contraction. And what we're doing is we're contracting all those muscles in these nice stable shapes so that when you do functional tasks, that's how those muscles contract, because that's what they have become used to because you've done a lot of repetitions of these. So this is actually what's called neuromuscular re-education. It's not strengthening, right? It's teaching muscles to fire in a certain way so you're not creating a collapsed thumb down here. You're keeping that nice arch whenever you do functional activities, okay? And then you're also gently loading in a controlled manner that painful joint up to a point where it's a little stressful. I had a mentor once that said go to the threshold of pain, but not go over that threshold. So nice and easy, okay? Gentle gripping with a ball or with therapy putty, same thing. If it feels good, do it, okay? If you got a tennis ball, squeeze it, but again, make sure that pain level is not going up. And then the last thing I want to go over with as exercises wise is what's called a Sirage decompression stretch. So you're going to put your knuckles right here. And again, you're not going to go like this, especially if you have any carpal tunnel symptoms. Right here, only go to where you can feel it, but not to where it hurts. Gently steeple your fingers right here. Up overhead. Come down behind your head like you're in a hammock on a nice summer day. And then out to the sides. And then you're going to reach back as far as you can. Squeeze those shoulder blades together and relax them back down. And that's great, especially if you have a lot of time in front of a computer. And the last thing you can do to help with your pain, supports and compression. The key thing here is finding the right support for you. So a lot of these repetitive strain, arthritis, chronic pain symptoms, you want to have a little bit of motion, right? You want to have a little bit of wiggle. So usually I'll recommend if you're going to do an splint or a brace, allow it a little bit of movement. Now you may have something that's so painful you just want to totally give it a break. So then you might want to get something that's a little bit more robust that just totally locks everything down. But really those aren't usually too functional. And again, if you can't use your hand, what's the point, right? But if you need to take a break every once in a while, those are fine. But for the most part, most of these things, the arthritises, the tendinitises, you really want to have a little bit of motion in there. So find something that's very comfortable that you can wear, and something that allows you to do the things you need to do. And then compression. So if you have something that gives a little bit of a squeeze around something that's painful, it's the same reason when you bonk your shin on a coffee table, the first thing you do is put pressure on it, right? You kind of rub it. So those nerve pathways that give that pressure response, they go to a similar pathway, to a similar part of the brain as your nociceptive responses, or those pain responses, and they interrupt that sequence of neurological events that create pain. And so if you give a little bit of a squeeze to whatever is painful, a little bit of pressure, that can help control your pain and bring your pain down. With compressive gloves, it's actually been shown that a little bit of compression goes a long way. And just because it feels good doesn't mean a whole lot of it's going to feel better. So you really want, oftentimes, the research has recently shown, you want to have really gentle compression around your hands. This isn't a knee or a leg, so you don't want those really, really tight, restrictive, Ted hose compression socks kind of pressure. You want to have a very gentle pressure, especially if you have any kind of neurological condition like carpal tunnel or something like that goes along with it. You don't want to increase pressure. So gentle compression, just like you're giving a nice gentle hug, supporting, that kind of helps ease that pain so you get through your day and do the things you want to do. So I hope that was all helpful. As exercises, I see that there's a fair amount in the Q&As there. So I'll do my best to answer questions that you might have. And yeah, I'll hand it back to Sarah at this point.
So first of all, thanks so much, Trevor, for sharing all that information. I always find it very interesting learning more about pain and how it works. It's definitely really helpful when you're living with chronic pain to deepen our understanding around that. As you mentioned, we have a lot of questions for you, so we're going to try and get through as many as possible in the next 15 minutes. If we can't get to all of them, I keep reiterating, Trevor can stay on the webinar with his screen off and on mute, and hopefully he'll be able to jump in and type some of the answers in for you. But let's see how many we can get through now. So I'm actually going to group these together because some of them kind of go together, and I'm going to start off
Sure.
talking about the hand exercises. So a quick, easy one. What was the decompression stretch called?
Sirage decompression stretch. I'm assuming it's named after a very humble doctor that designed them. Hussein Siraj, I believe was his name. And so basically the principle is that your nerves become compressed because the soft tissues that go all the way up your arm, your shoulder, into your shoulder girdle and neck become tight. And in this case, I thought it was helpful because they become tight oftentimes because our hands hurt. So we tighten everything up. And so those nerve decompression stretches decompress the nerve by re-lengthening and rebalancing all those soft tissue structures.
And for those of us who are doing, like me actually, who are doing these hand exercises and can't necessarily do them to the full extent, or maybe we have fingers that won't bend, or when we're doing them, we start to maybe hear like a sort of crackling noise or popping feeling.
Yeah.
Give us some advice about that. Can we still do these things, or
yeah, absolutely. And feel free to modify it. It goes back to what I was saying about listening to your body. You know, a little bit of motion is whatever you can do is usually good to do it. So if you're getting a little bit of clicking and popping, it's called crepitus. First question I ask is, does it hurt? And if the answer is yes, I say stop. If the answer is, well, kind of, but it's really more annoying, then I say, well, how about we proceed with caution? And if the answer is, no, I just kind of notice it's a little crunchy in there. And I go, well, it's probably okay. But again, keep an eye on it, make sure it's not getting worse. In regards of changing things, so the handout that I have at my clinic that I give to people for the nerve decompression stretches, for instance, I always remind people that the gal that I have in the pictures for that handout was a student of a colleague of mine who is in her mid to late 20s and has absolutely nothing wrong with her. So don't hurt yourself trying to copy what she's doing. You know, so some simple ways of changing that one around are if it hurts to have your arms all the way extended, put a little flex in your elbows, bend your elbows a little bit. If it hurts to put your hand behind your head, then go to whatever feels comfortable, right? A little bit of stress goes a long way. And then over time, you can work your way over to it. With those 6-pack tendon glides, if you got something that's not quite coming down, then just go to whatever feels good, right? This is the goal, right? But, you know, especially if you've got arthritis to the point where a joint's almost fused or you've had it fused surgically, you know, just move what you can around that joint and move it as much as it can. But listen to what your hand is telling you. If it hurts, knock it off, stop it. There's nothing that I'm going to give you or anyone else is going to give you that is a magic silver bullet that will fix everything for everyone, right? You should be taking these things and trying them out, but listening to what your body tells you. I'm sounding like a broken record with that, but it's key. It's critical to reducing pain, especially chronic pain states.
Okay. So I have a question here from Marissa. She asks, could you please talk a little bit about the comorbidity of carpal tunnel and rheumatoid arthritis? She was initially diagnosed with carpal and then later diagnosed with rheumatoid.
Yeah, that's a common thing. Mostly depending on who diagnosed you first. If it was a general practitioner, you know, there's a lot to know, and general practitioners are critical in our medical care. But sometimes they'll give a diagnosis to the best of their abilities, and then they'll send them off to whatever specialist they think is more suited towards whatever that thing is. And then over time, your diagnosis might change a little bit. But carpal tunnel is pretty common with a lot of these things, just because when you have a pain state and an inflammatory process, there's not a whole lot of room in that carpal tunnel right there that median nerve passes through. And so if you have, especially rheumatoid, and you have a flare up and a general inflammation, that's going to create swelling. And that swelling and inflammation is going to get into that carpal tunnel. And it's really common then that that carpal tunnel becomes compressed, and that nerve in there becomes compressed. So you could have both, whether or not it's the RA on its own that caused it. Who knows? I try not to spend too much time trying to figure that kind of thing out. But the carpal tunnel is very specifically going to be numbness and tingling at these 3 digits and sometimes the end of this digit. It's a very specific effect as far as the nerves go, right? It's going to be here. If you've got nervy stuff going on in the palm or down the arm, sometimes that's usually going to be indicative of something else going on further up the arm in the elbow or even the shoulder or neck.
And while we're on the subject of rheumatoid, we've had a couple of questions specifically on that. And I'm going to put them together because I think they kind of go together. The first one is about how can we prevent further problems that could happen with rheumatoid. And we also have another question that's specifically about rheumatoid nodules and whether they would need to be removed if they occur on the hand.
Specifically, I mean, the biggest key for rheumatoid is finding a good rheumatologist, honestly. The thing that I see clinically when I find someone that has an early signs of rheumatoid is there's a bit of a hesitation to even go and get it treated. I think there's a bit of, we have this instant idea that with rheumatoid we are doomed to have these horribly disfigured joints, and the fact of the matter is with modern medications that doesn't really occur nearly as much. I don't treat most rheumatoid in clinic anymore because it's so well controlled generally with biologics and medications that they have today. It can take a while to get there. There's a lot of hit and miss trying to find the right medication, as I'm sure a lot of you know, Sarah can attest to. But getting a rheumatologist and a good team behind you that can help with that means that you probably never have to see a guy like me, because that can do a nice job of controlling things. I think last I heard there was something like an 80 to 85% remission rate is if you get on the right medication.
Well,
First of all,
yeah, let's park that one because there's a bit of controversy around that.
yeah,
But and,
yeah,
but coming back specifically to rheumatoid and
yeah.
hands, because
So
I've got to be careful not to delve down this subject too much.
no, yeah, that's fair.
Yeah, no, I could talk for hours about it. But rheumatoid nodules,
Yeah.
are
So
they something
rheumatoid
that need to be
nodules,
removed?
from my standpoint, again, that really depends if they're painful. Again, but most people with rheumatoid, it's a bit of a tricky subject. So from my area of expertise, I help with activity modification, energy conservation, and talking about what are the mechanics that create that ulnar deviation that's very common with rheumatoid, and how do we lift things, carry things, use our hands in ways. What are some adaptive devices that can help with that? As far
And
as things
sorry.
like surgeries go, I leave that up to the surgeon, right? If I think that there might be something there, I go, well, you can talk to a surgeon. Never hurts to talk to a surgeon if you have that ability to. And then same thing with medications and all that kind of stuff. It's not really within my scope of practice. My scope is, how can I help you with the symptoms that are created by rheumatoid, and how can I help you with the biomechanical issues that go into deformation of the joints and irritation of those tissues.
So that leads nicely into a couple of other questions we've got. I'm going to, well, psoriatic. We have someone who has psoriatic arthritis and has a lot of hand pain, deformity, and she describes her sausage digits.
Yeah.
And so she's getting horrible pain, which she describes as her fingers screaming at her. She says that if she squeezes or pops the joint, it relieves it a little bit. Is
Sure.
popping a bad thing?
No, the whole popping joints causes arthritis has been pretty much proven not to be. I mean, with arthritic joints, if there's a deformation of the joint, again, proceed with caution, right? But I mean, if you're at the point where your fingers are already screaming at you, if you're describing it like that, and popping the joint feels good and reduces your pain and allows you to do the things you need to do, the chances are you're not going to create a lot of deformation and change in that joint above and beyond what's already going on with that disease process. I wouldn't worry about it too much. That might be something that you want to talk to, again, your surgeon, your doctor about, your rheumatologist about, so they would have an idea of specifically what's going on there. Like if you're popping it and it's an instance of, like, you know, a bone spur or something popping over a tendon and you potentially creating fraying of a tendon or a ligament, yeah, that's going to be problematic. But those generally will go along with the pain response. But especially squeezing it, no. Compression, no, absolutely. Yeah, if it feels good, give it compression. Give it a nice squeeze. Get yourself a nice pair of compression gloves, right? Sometimes a lot of compression feels good momentarily, but
Yes.
generally speaking, for something that you're going to wear a long time, you want to go gentle compression. That over time, that's gonna aggravate your symptoms or even cause like some sort of, you know, you could potentially cause nerve irritation, possibly, if you have excessive compression on there. But yeah.
So in terms of, we had another couple of questions coming about exercises. Specifically, have you got any exercise you recommend to reduce stiffness in fingers? And that's someone who has rheumatoid and I'm not sure how to pronounce this, dactylitis.
Okay.
And then we've also had a request for some exercises for someone who types a lot.
Okay. So those six-pack exercises are kind of my general go-to. Those are designed specifically to move each joint in each finger, and then each tendon that goes to those fingers, get those differentially gliding, so that any sort of swelling or any adhesions from fibrotic buildup or scarring get broken up or helped. So those are usually my go-to for that. Open and close is great. If you're having some hand pain, so for typing, the problem with keyboarding and typing is your hands tend to be in this sort of arched position all the time. There's not, people will come in and I say, "Are you doing your hand exercise?" And they say, "No, but I'm keyboarding." And I go, "Well, that's possibly making it worse, right? Because you're always here." So really stretching out into those end ranges, whatever is comfortable, whatever doesn't cause pain. And then sometimes I'll give what's called a blocking exercise. So that's when you come here, you block a joint, and then you try to curl your finger around just like that. And that targets these IP joints here. They're called interphalangeal joints. And it stretches a little muscle that lives in your hand called your lumbrical, that can get really tight and cause some discomfort and pain, and even sometimes will cause some carpal tunnel type symptoms. So it's a good one to try to stretch out if you're doing a lot of keyboarding. There's tons of exercises and stretches available on the internet too. I mean, if you Google exercises for keyboarding, or going back to the theme, listen to your hand, listen to your body. If you start doing something that you found on a random YouTube page and you haven't, it hasn't been vetted and no one sent it to you that you trust, or like a therapist or a doctor, even if it was, if you do it and it hurts, stop doing it. Don't do it if it increases your symptoms.
Okay, so we've got time for one more question. Before I do that, get into that, I'd like to thank you so much for sharing all this information, answering all these questions. We have had so many questions for this session. We just can't get to all of them. So Trevor, I will encourage you to stay on and see if we can answer some afterwards. And just a reminder to everyone, we are doing this big follow-up with you afterwards. You're going to get all the videos, and we're going to include, you know, all of this information and follow-up question and answers. So the last question is one we actually hear a lot, which is about crafting. So Katie says she used to really enjoy doing crafts such as crocheting, but
Yeah.
hasn't been able to do it because of arthritis. Do you have any suggestions on how she can work it into her life? She really misses it.
Um, so that is also one I get a lot as well. And it really depends on the level of pain, the level of arthritis, the joints that are affected. Honestly, I would suggest if you have access to a certified hand therapist, trying to go in and see one of them and working with your particular case. Because my job as a hand therapist is to get you back to doing those things as best we can. I know that there are out there, and it's been a while since I've looked for specific products, but there's adaptive equipment for everything, and especially for anything involving hand arthritis. So I imagine there's got to be some sort of adaptive equipment, maybe a built-up handle or something like that for crocheting. You're not alone in this being an issue, and anytime there's a lot of people that have the same issue, eventually someone comes along and tries to help resolve that problem. But that would be my advice is, activity modification. So the biggest thing, people, they get caught up in the crocheting, or they've got to crochet something for someone by like Christmas, right? And then so they have to get it done. I make a joke all the time that I'm going to get the words "it had to get done" emblazoned in quotation marks in my clinic, because it's the number one thing that people come in when their hands are all flared up. So energy conservation and time management, so you can break up those things into manageable chunks. If you can do even 2 minutes of crocheting at a time, and then maybe some gentle stretches and a hot pack, and then go back and do 2 minutes and maybe work up your tolerance, that could be a way to break that task up to make it manageable and doable without creating a lot of pain. But I would suggest trying to maybe working with a hand therapist to find out what's right for your particular situation, to
Okay.
see if they have any ideas.
I'm afraid we're going to have to cut you off. We could talk about this all day. We've just had so many questions, but we have another session coming up, which is going to be about fatigue, which is another huge, huge subject. So I'm now going to hand over to Cheryl, and she's going to take you into your next session. Thank you again, Trevor.
Yeah, thank you.